This program is made possible by the support of Delta Dental, Quick Trip, Marshfield Clinic Health System, Wisconsin Counties Association, Wisconsin Hospital Association. Watch WisconsinEye on Spectrum Channels 995 and 363 and at wiseye.org.
WisconsinEye. Before opening remarks and your questions, a reminder to maintain quality audio. Please keep your phones on mute until it's time to ask your question. If you are able to do so, please use *6 to mute and unmute your phone. In the interest of time, please be prepared with one question and one follow-up. If you don't have a question, please say pass and we'll move on to the next reporter. Joining us for today's media briefing are Governor Tony Evers, DHS Secretary-Designee Andrea, and Dr. Ryan Westergaard, the Chief Medical Officer with the DHS Bureau of Communicable Disease. And we will begin the briefing this afternoon with remarks from Governor Tony Evers.
Good afternoon, and thanks for joining us today. With great sadness, last night we confirmed the first 2 deaths in Wisconsin related to COVID-19. And by the time we woke up this morning, there had been a third confirmed death. Unfortunately, this number is expected to rise, and things will get worse before they get better. Our hearts go out to the families and communities mourning these loved ones. This is a difficult time for those who suffer with this illness and those that face fear, uncertainty, and hardship due to the impact this virus is having on our economy. The fight against COVID-19 will not be easy, but my administration and the Wisconsin Department of Health Services are working tirelessly to protect the health and safety of the state of Wisconsin. I want to recognize the hard work and courage of those caring for the patients with COVID-19 and all those on the front line in the fight against this outbreak. I want to say again and deliver this simple message: stay at home. There are folks working around the clock to keep us all safe. Our healthcare workers, our first responders, farmers, manufacturers, grocery store employees, and they can't stay at home. We need these folks to stay healthy so that they can continue to serve our communities. So please only leave your home if it's absolutely necessary. In addition to encouraging you to stay home, I'd also like to take the opportunity to update you on some of the ways the state is working to respond to COVID-19 and help those who are impacted. First, I will again remind folks that we have an important election coming up. We'll continue to closely watch the situation, do everything possible to make sure that we have fair, safe elections. As I've said before, people should vote absentee. This is the best and safest way to vote. The state is working with the Wisconsin Election Commission to help ensure our local clerks have what they need. But folks, I want to encourage you to request your absentee ballots now. Do not wait until the deadline of April 2nd. Visit myvote.wisconsin.gov to request your ballot. That's myvote.wisconsin.gov to request your ballot. Requesting an absentee ballot isn't the only government service you can complete online. State agencies have taken a number of steps to make online services more available and accessible so that our workers and the public can remain safe. An example is the Department of Workforce Development, which is working diligently to process an unprecedented amount of claims so that the much-needed economic assistance makes it into the hands of Wisconsin families. I encourage individuals who are out of work due to COVID-19 to visit dwd.wisconsin.gov and file their unemployment insurance claim online. Roughly 90% of the individuals are able to start and complete their claim online without the need to speak to a claims specialist over the phone, and you can avoid waits. The DMV, to minimize in-person visits at DMVs, driver's licenses and commercial driver's licenses that expire during this public health emergency will be automatically extended for 60 days. Late fees will be waived, and all vehicle-related transactions can be done online. Wisconsin Economic Development Corporation is leading a webinar on small business strategies to cope with COVID-19 and has released a brochure of some of the best practices to follow. We are also working with the federal government to unlock disaster assistance loans. State government is also working to support essential sectors of our emerging response. The Department of Children and Families is working with healthcare providers and workers in critical fields to find child care and is developing a plan for on-site child care that can be used by hospitals across the state based on a model that Epic Systems and UW Health have used. Additionally, DCF is continuing plans for group homes, residential care centers, and other shelter-like environments to maintain service. The Department of Agriculture, Trade, and Consumer Protection is focused on keeping food on Wisconsin shelves and supporting the industries we serve. Through regular communication with our agriculture partners, we hear farmers loud and clear, and we're working to ensure that the safety and stability of the state's food supply is maintained. We're also helping consumers protect themselves from price gouging, fraud, and scams during this clearly confusing time. The Department of Safety and Professional Services is working with state boards, the administration, and legislatures to take the actions necessary to maximize the available healthcare workforce. This includes advocating for rules suspensions, legislative changes, as well as prioritizing review of license applications for those healthcare professions. And the dedicated staff of the Wisconsin Department of Veterans Affairs is working hard to help ensure that veterans and others who live and work at our state veterans' homes are kept healthy and safe. The individuals who live at these homes are among those at the highest risk, and we are very appreciative of the work that healthcare personnel and others who work at these skilled nursing facilities for all they're doing. Over the last several days, I have been in contact with hundreds of workers, small business owners, manufacturers, locally elected officials, first responders, and members of our healthcare workforce. And what I've heard from them is that they are ready to stand up and help. The State Emergency Operations Center remains at a level 1 response in support of my office and the Department of Health Services. Staff from the Wisconsin Emergency Management are working alongside other state agencies, along with nonprofit organizations and the private sector to address critical needs being reported by county and tribal governments across the state. Small example, the Red Cross is assisting DHS in planning operations as well as identifying volunteer manpower resources. And I'll remind folks again, if you're able to donate blood, please do so. We're coming up with a critical need in that area. And helping to support us all is the Wisconsin National Guard. Under the leadership of Major General Paul Knapp, the Adjutant General of the Wisconsin National Guard, our 10,000 soldiers and airmen from across the state are ready to serve by assisting state agencies with logistics and planning, specimen collection, providing a source of medical professionals, and more. Members of the National Guard are friends and neighbors here in Wisconsin, and they have once again answered the call to serve our communities and help keep us safe. Together we can make a difference. I urge you to stay home if you can, and especially if you're sick. Wash your hands frequently and thoroughly and practice social distancing. These recommendations are vital for keeping our healthcare workers safe and helping to stop the spread of COVID-19. Thank you so much, and now I will turn it over to DHS Secretary-Designee Andrea. Andrea.
Thank you, Governor, and thanks to all of you for joining us again today. First, I want to join the Governor in offering our deepest sympathies to the families of the patients who passed away. Our hearts go out to them and to the people suffering from this virus. This has been hard, and I'm sorry to say that we do expect the situation to worsen. We know from what we've seen in other states and other countries that COVID-19 will affect thousands of Wisconsinites. Most of these illnesses will be mild, but for others, including our most vulnerable, outcomes will be more severe. Sadly, These deaths won't be our only deaths. We will see more. We need to start preparing for that and for the reality that this is going to be a very hard time for Wisconsinites. There are things we can do. We can protect our neighbors and our friends who are vulnerable and those who work in the healthcare system by staying home. This means people should not travel unnecessarily. We should each cancel all of our non-essential appointments. We can prepare for the increased need for our healthcare system, and we can come together to support each other through this pandemic. Please call your friends and family, check on them, talk through it, support each other. So here's where we stand today. There are 3,455 negative tests, and we now have 206 positive cases in the state of Wisconsin. As the governor said, we have updated our restrictions on mass gatherings of 10 or more people to avoid further spread of COVID-19. Let me take just a moment to be clear about what we mean by social distancing. Please keep 6 feet between people and avoid direct physical contact. We know these increased restrictions impact your lives and the day-to-day business of places like hair salons, tattoo parlors, and other services that require close contact, but it's necessary to take these steps. It is also imperative that we continue to remain vigilant with our health hygiene practices. Please wash your hands frequently with soap and water, cover your coughs and sneezes, and stay home as much as possible, but especially if you are sick. While most cases of COVID-19 have been among people older than 50, younger people, particularly those between 18 and 30 years of age, aren't immune to COVID-19. Anyone can contract the virus, and it's as important for young and healthy people to heed the orders requiring social distancing as it is for the rest of us. Please take this guidance seriously for your health and the health of those around you. This is critical to our collective ability to flatten the curve and protect the capacity of the healthcare system to serve those who will suffer with the most severe disease from COVID-19. I want to personally acknowledge the tremendous efforts of the healthcare community throughout this public health emergency so far. We will continue to need them on the front lines, and so all of the efforts of those of us around the state are critical to helping them do their jobs. Yesterday, we notified healthcare providers that the supply of personal protective equipment, such as masks, that we are going to receive here in Wisconsin from the federal Strategic National Stockpile won't be enough to meet the needs of our healthcare facilities at surge capacity. This is obviously very concerning to us, and the governor and I continue to look for ways to mitigate the shortages and protect those who are on the front lines taking care of sick people. We are working to increase access to telehealth in our Medicaid and Badger Care programs, and other partners are also working to increase telehealth options for all Wisconsinites, again in an effort to protect our healthcare workers from potential exposure. Where possible, please use telehealth for your healthcare appointments. This will protect healthcare providers, yourself, and others. Again, I want to thank the people of Wisconsin for their adaptability during this public health emergency. Many of you are now working at home while your children prepare for learning outside of the classroom. You've kept up your visits with family members in nursing homes and assisted living facilities with phone calls and FaceTime. You've canceled appointments and long planned for trips, and some of you we know are struggling with the uncertainty of whether or not you will have a job or a business when all this is said and done. We will continue to ask more of you in the days and weeks ahead. Yet we continue to be amazed at the way you have taken this pandemic seriously and risen to the challenge. We can't thank you enough for the sacrifices you're making for the health and safety of the people of Wisconsin.
Thank you, and we'll now open it to questions. A reminder to maintain the audio quality. Keep your phones on mute until it's time to ask your question, and we'll take questions in the order of the RSVPs. One question and one follow-up, please. And we'll begin the questions with Molly Beck from the Milwaukee Journal-Sentinel. Molly. And a reminder, star 6 to mute and unmute your phones. We'll move on then to Patrick Marley from the Milwaukee Journal-Sentinel. Okay, we'll move on then to Tim Vetcher from TMJ4 in Milwaukee. Tim?
Hey,
Hi there.
this is Patrick.
Hello.
I'm sorry, I was.
Okay.
Yeah, thanks for taking the call here. Could you? California and Illinois have issued shelter-in-place orders. You're encouraging people to stay at home. At what point might we see that order specifically that people must stay in their homes from the governor?
But I believe that we'll be able to avoid that. People in the state of Wisconsin are taking this seriously. We continue to encourage them to stay at home, but I know other states are doing that. We will follow the science on that, and we don't anticipate doing that. We do believe that people are going to be moderating their behavior, and will continue to do that.
Thanks. And for my follow-up, election workers are very concerned about having enough poll workers. Are you considering having the National Guard come to assist at the polls?
We're looking at all options. We are encouraging folks that are interested in helping out in the polls, contact their local authorities. I think that's very, very important. I've talked to many, many mayors over the last couple of days. They're concerned about that same thing. They're encouraging others to step into the fray and make sure that our polls and elections go off without hitch. Is it an issue? Absolutely, but we're going to continue to do that. The National Guard may play a role in doing that. I just have to say the National Guard has been extraordinarily helpful here. They are our neighbors and our friends, and they live all across our state. They're regular folks, and if they can help us out, we're very, very glad to take that help.
Thank you, Patrick.
Thank you, Governor.
Thanks.
To Tim Vetcher from TMJ4 in Milwaukee. Tim?
This is Rachel from TMJ4 standing in for Tim. Hello.
Hello, Rachel.
Governor Evers, are you considering an order for people to shelter in place? And also, can you go into a little more about what the role of the National Guard will be?
Certainly. To repeat, the shelter in place I know is being done in other states. We believe our present situation where we're asking people to stay home, making sure that they're doing the things that they need to do about washing their hands and keeping a significant distance between them and others. If you're sick, for sure stay at home. We believe that's an adequate response. We do not have plans to shelter in place. We think what we have going right now works and will continue to work. The question about the National Guard, as I just said, the National Guard are our friends, our neighbors, and they do great work all across the state. And I'll just have to cycle back on that just even a little bit more. Governor, it's clear that the National Guard plays a huge role in all sorts of disasters. They worked with us during tornadoes. They worked with us during flooding that happens in the state. And basically, I encourage the people of Wisconsin to understand that they're friends, neighbors, they're regular folks just like all of us. They care about the state of Wisconsin, and they're going to help out in any way possible, and that's what they've been doing thus far.
We're going to try one more time for Molly Beck from the Milwaukee Journal-Sentinel. Molly? And a reminder, star 6 to mute and unmute your phone. Okay, we'll move on then to Casey from Fox 6 in Milwaukee. Casey?
Yes, hi. Thank you for doing the call. Can you hear me?
Yes, we can.
Okay, thank you so much. Just a quick question. Wondering if you can quantify how many hospital beds do we currently have in the state, and how many will we need? Even if it's an estimate.
Yeah. So, Casey, I want to differentiate between hospital beds and ICU beds. The inventory of hospital beds is larger than, obviously, the ICU beds. What I can tell you is that currently there are about 2,500 ICU beds in the state of Wisconsin. And obviously, hospitals, as they are planning and preparing for this, they are looking to see how they could convert other beds in the hospitals to be used for this purpose. And those are very actively happening in every hospital across the state. But if you're talking about normal course of business, there are currently 2,500 ICU beds in Wisconsin.
And do you know how many we might potentially need?
This is evolving rapidly by the hour, and that work is being done right now to estimate our surge needs and to work with our partners at the EOC and across the state to be able to do what we need to logistically and from an infrastructure perspective to expand our capacity to meet a surge need. But that work is very actively, that planning is very actively happening right now.
Thank you, Casey.
Okay, and then for my... Okay.
And moving on to Jeremy from urban Milwaukee. Jeremy? A reminder, *6 to mute and unmute your phones. Jeremy from urban Milwaukee.
Pass at this point.
Okay, thank you. Two reporters from Milwaukee Public Radio, beginning with Susan Benz. Susan from Milwaukee Public Radio. Then we'll move on to Emily Files, also from Milwaukee Public Radio.
Yes, my question is for Governor Evers. I'm wondering what your plan is to protect the health and safety of prisoners in Wisconsin, especially those in the Waupun prison, and what your response is to the calls to release more vulnerable prisoners.
Yeah, great question. We have already, right from the beginning, implemented.
Hi, this question is about. Can you hear me?
We're on another question right now with Emily Files from Milwaukee Public Radio.
Okay.
Department of Corrections instituted, as this unfolded, significant changes in how things are operating in all our Department of Corrections institutions. Your reference has done a great job at making sure that the people that we're responsible for are safe and secure and continuing to receive services. That said, we had an incident at one of our institutions where one of the people that work in it was determined to be have the virus. Obviously, we're working to change, or working to make sure that whoever he was connected with is also being taken care of, and I believe that is well under control. As it relates to suggestions about releasing prisoners, we're looking at all those possibilities. But to be honest with you, right now, the way we're operating in the corrections institutions, I feel very confident about not only the safety of the prisoners, but also the safety of the people that work there. Obviously, this is very stressful for the Department of Corrections, the people that work there, the people that we are responsible for, and we keep their safety as a top priority.
Thank you, Emily. Moving on then to Victor from CBS 58 Milwaukee. Victor?
Good afternoon. One of the pieces or pieces of equipment that's obviously in high demand right now is the personal protection equipment for hospitals and nursing homes and places like those. I guess what's how's the prioritizing for distribution for this equipment kind of happening as we move forward for that demand?
So I'll start, and then if Dr. Westergaard wants to fill in any details, I would certainly welcome that. As you mentioned, we have received a shipment from the CDC out of the Federal National Strategic Stockpile with plans to distribute that around the state. The prioritization process was done in consultation with a medical advisory committee of experts from around Wisconsin, and our focus is on, with this first shipment that we've gotten from the federal government, to make sure that counties with community spread and with cases are high priority, as well as long-term care facilities, considering the vulnerability of the folks who live there. But as we receive more from the federal government, we will continue to make sure that our priorities are as tight and as reflective of the current situation as possible, and we'll continue to move pieces out as we receive them to communities across the state. Did you want to say more, Ryan?
Yeah, I would add the main considerations there were about three. One, of course, is geographic considerations, and that there's communities where we know that there's community-level transmission, where people who are on the front line need to be protected from people who are potentially asymptomatic and not necessarily known. So we wanted to prioritize requests that came from facilities in those jurisdictions. The second, as you mentioned, was based on need in terms of vulnerability, the number of the patients and people who are being cared for that have medical vulnerabilities. And then thirdly, we felt it was very important to prioritize first responders, who are really the key workforce in terms of transporting people who might need medical care from their home setting to the hospital setting. So those were some of our priorities when we made those determinations.
Victor, do you have a follow-up?
Yes, I did. One of the things brought up in the news conference with President Trump today was how some state governments are having to compete with the federal government in terms of bidding for equipment to respond to the outbreak. Has the state kind of encountered that, where they're bidding for some equipment, they're getting outbid by the federal government, and how is that being handled?
This is Andrea. I'm not sure specifically what kind of equipment you mean, but this is globally, everybody's looking for the same kinds of things to fight this epidemic, whether it's reagents that we need to run our testing, whether it's personal protective equipment to keep folks from being infected, whether it's hospital equipment like ventilators. All of these things are things that are needed worldwide, and so we are all competing. States are competing, communities are competing, countries are competing, and the work that we are all doing to work with our partners in the private sector to expand manufacturing capacity where we can, to be creative about converting manufacturing lines, to do the kind of work that is necessary to help mitigate some of these shortages, are places where we are working hard through our statewide response to use those relationships and connections to businesses across Wisconsin to work together to try to solve some of these problems. But there's a shortage of a number of things, and it is a global problem.
Thank you, Victor.
Okay, thank you.
Andy from WISN in Milwaukee. Andy?
Hi, it's actually Matt Smith, WISN. Governor and Secretary, thank you. Hey, if you could expand just a little bit on the restrictions you talked about and the updates. At this point, in your mind, should every hair salon and tattoo parlor, for example, be closed? And are you guys comfortable with people still physically walking into restaurants for takeout? We saw some action in Fond du Lac County on those fronts today.
So I can say a few things broadly, and then if others want to chime in, I would welcome that. So this order, the order that I signed a bit ago, provides some additional clarity. We were getting, understandably, a number of questions about how this applied to specific businesses, and you mentioned hair salons as one, and that was certainly a place where we were getting questions. And so this new order does restrict hair salons. If like restaurants, where you can pick up at the counter with appropriate social distancing a bottle of shampoo that you need, that would be allowable. But the social distance piece of that is what's critical to whether you remain open. Doing actual haircuts in that close proximity over a period of time is something we say should not be happening anymore. So this order was designed to give some additional clarity in the areas where we were receiving the most questions, and we wanted to get that out for people's use, again, to just really clarify where we are.
And a follow-up to WISN?
Yeah, real quick. Thank you for that. In the governor, in your news release last night announcing the deaths, you also mentioned what was called a shortage of ingredients needed to run tests. Curious the severity of that problem and where that stands today.
Well, I know Secretary Palm can answer it more directly, but the reagents that are used in the process of determining a test result is a shortage. It wasn't in a shortage area, and I know Secretary Palm and my administration have been working with several companies here in Wisconsin to help alleviate that. And I'll ask, she can respond directly to that. But I just have to say one thing about our ability to access either protective equipment or chemicals such as reagents that go into the process of testing. I believe it was a step forward for the federal administration, essentially, to pass this off to regional emergency management folks. As a governor, I've been frustrated with the idea that somehow the conversations are happening via press conferences here, press conferences in Washington, D.C. Now we have actual people that are on our side, that are in the federal government, that are helping us solve this problem. And so I think there's a step forward, and I had a conversation with the emergency management people, regional people today, and I know others in my administration have. And I think it's better suited result for us to get these materials. But Andrea, I don't know if you have specific information about reagents that you want to address.
Yeah. So on the reagent front, it is a particular kind of reagent that is used it's an extraction reagent, they call it, and it has been a shortage issue, not only here but in other states and around the globe. And I think the thing to remember and understand is that different platforms, different kinds of tests can use different kinds of reagents, and so they come in and out of shortage based on their use in these different kinds of systems, different kinds of platforms. And so we do have shortages pending here. Everybody is struggling with them, and as the governor said, we are working very hard with a number of our private partners here in Wisconsin to mitigate those shortages and allow us to expand our testing capacity so that we're able to do everything we need to do on the testing front as it relates to this outbreak. Did you want to?
Yeah, I'd say there's maybe two specific things that we're doing to mitigate the potential shortages. One is that the number of labs that are doing testing right now are continually taking inventory and also collaboratively sharing information about about their capacity. So if one lab is running short of a particular reagent, they can communicate with partners and share, and that is actually happening, and we're encouraged by that. The second is to diversify the different technology platforms that are being used for the testing that aren't all dependent on the reagents. There are several that our laboratories can use. So they want to make sure that they have multiple channels open so that if there is a national shortage of one reagent for one type of platform, they can switch to another one. So our most recent meetings with them, we are in good shape for at least the next week, but they're always looking down the road to see what are potential shortages and coming and trying to be ahead of that. So it's a concern that there could be looming shortages. Right now, the capacity of the laboratory that we discussed last week seems to still be going okay, at least for the better part of next week.
Thank you. Moving on.
Thank you.
Thank you. David Wahlberg from the Wisconsin State Journal. David?
Yes, hello?
Hi.
Yeah, hi. Secretary Palm, thank you for doing the call. You mentioned that the Wisconsin share of the stockpile is relatively limited, and as you know, we're hearing from hospitals and workers that there are maybe shortages of masks and gowns and face shields and gloves and so forth. Other than telehealth, which you mentioned, and reaching out to manufacturers to try to make more things, what is DHS doing to try to increase the supply, and what can you do?
It's a great question. So there are a number of strategies, and I should let Dr. Westergaard talk about these that relate to helping healthcare providers use the protective equipment they have most efficiently, and that includes ways to clean and reuse things like goggles or face masks that are washable. Like there are some preservation strategies that we are certainly working on with healthcare facilities, but we really need, because this is a shortage for everybody, we do need additional manufacturing capacity, and we need to ramp up in the private sector and their ability to supply the demand that exists here in Wisconsin and around the country. And we are working very hard with a number of folks here in Wisconsin who have called to say we'd like to help. We would like to convert our manufacturing to pitch in on hand sanitizers, on protective equipment, on a variety of things. And so our statewide response is very actively pursuing all of those opportunities, and as they come online, we will certainly want everybody to know how our partners in the private sector have really stepped up to help us in this effort. But if Dr. Westergaard wants to say something about the guidance we've done on...
Sure.
Yeah.
We've shared some best practices for conservation or contingency strategies for personal protective equipment that has really been agreed upon at the national, international level for not what we would consider usual best standard practice of care, but acceptable care in contingency situations. And examples of these are, I think, for face masks, probably most commonly, the standard being wear one mask with one patient encounter in the hospital, for example, throw it away before you go to another one. So reuse or prolonged use of a face mask, provided that it's not contaminated and no one touches it, is an acceptable strategy, even if it's not our normal strategy. So there's been some consensus around things that can still protect patients, even though they're not what we consider the usual standard. And I think it's helpful that these panels of experts have sort of convened and say, let's accept that these are appropriate strategies. So we want to make sure that everyone feels comfortable that we're protecting people the best way that we can, and we don't have the supply to do what we normally do.
And do you have a follow-up, David?
Quick follow-up. You mentioned 2,500 ICU beds statewide. Do you have a ventilator count statewide yet?
I do. We have 620 vents in the state. There are some in the Strategic National Stockpile, and we do expect that we will be able to access our share of those. So we do anticipate some coming from the Federal Strategic National Stockpile, and also I do know that hospitals and partners and we are working to look for any place we might be able to purchase additional ones, just to make sure.
Thank you, David. Now to Mitchell Schmidt, also with the Wisconsin State Journal. Mitchell?
Yeah, thank you very much for the call today. I was just kind of curious, the governor had mentioned earlier this week possible legislation in response to COVID-19, and obviously it was mentioned that there's been ongoing discussion with leaders in the Assembly and Senate. I'm just curious, at this point, does that still seem like you will be pursuing legislative action, or does it appear that at this point the actions as a result of the public health declaration have been sufficient at this time?
No, we believe that legislation will be necessary. We have ongoing conversations with the important legislative offices. So we believe that sometime in the near future we will be seeking legislation.
And a follow-up, Mitchell?
Any idea if that would be, I mean, when you say kind of the near future, like next week, or is that something that hard to say?
It's hard to say, but I would say it will not be next week.
Okay, thank you.
Thank you. To Robert from Madison 365. Robert? And a reminder to press star 6 to mute and unmute your phone. Robert from Madison 365. And we'll move on then to Danny Maxwell from WKOW-TV in Madison. Danny? Danny from WKOW? Okay, we'll move on then to Parker Shore from the Cap Times in Madison. Parker?
Yeah, do you know the figures for the number of healthcare personnel that have tested positive for coronavirus and the number that are currently quarantined?
So, no. We know that as of today, the number of positive cases and the number of negative cases, we are not commenting on individual PUI, persons under investigation, or positive cases. As we want to make sure we protect the privacy of those people, but we are in very close contact with our healthcare facilities to make sure they have what they need if and when they have a positive case and need assistance from us or from their local public health department to do the contact tracing and take the necessary steps to protect that worker and others who may have come into contact with them.
A follow-up, Parker?
And just to clarify, the 2,500 ICU beds, that's the total amount of ICU beds in the state, or is it the number of available ICU beds in the state currently?
It's the total number.
And do you have the available number?
I don't off the top of my head, right? It changes day to day, and that is something that we are able to see in real time, and so and it's part of how you think about planning for a surge. You need to understand what your typical vacancy rate is, and then be thinking about how you help expand that where necessary using other resources. And so that is very actively underway right now.
Thank you, Parker.
Thank you.
Mason Dowling from WAOW in Wausau. Mason?
Hi, can you hear me?
Yes, we can.
Hi, perfect. First question is just for all parties involved. With the now 3 deaths due to the coronavirus, were all 3 of those people older with pre-existing health conditions, or are they meeting the identity of kind of the most susceptible victim that we've been seeing?
So what we said yesterday about the 2 deaths yesterday, one was a gentleman in his 90s, one was a gentleman in his 60s, and the third case, which we confirmed today, is a gentleman in his 50s.
Okay, and then a quick follow-up, and this one is more for the governor than anything. And I understand, sir, it's not exactly your purview, but today it was announced that the federal tax day would be pushed back till July. Is the state tax deadline planning to be pushed back as well?
All I can tell you is that the Department of Revenue is looking at all taxes that we receive in the state and looking at what alternatives are possible. So we'll keep people informed on that. Obviously, it's coming close to that time, but our Department of Revenue is looking at all our alternatives on that.
Thank you.
Thank you, Mason. To Ben Meyer from Rhinelander. Ben?
Hi there, Ben Meyer at WXPR, Public Radio in Rhinelander. Probably for Secretary-Designee Palm or the governor. I think we've all gotten used to seeing the excellent map that DHS has with the red dots in the various counties across the state. None of those counties are here in the Northwoods where I am. Should people in the Northwoods and in this northern part of the state expect at some point to see a red dot in every single county in our area?
I think as testing expands, as this evolves, you're going to see cases all across the state of Wisconsin. which is why these social distancing, the recommendation to stay home as much as possible, those kinds of actions will reduce the number of cases that counties in the Northwoods see, and now is the time to do those things to help prevent the spread. But I do think the counties all across the state should expect to see cases in their counties.
And if I can ask a follow-up, to that, please. Our hospital capacity in rural areas of the state is certainly different than it is in urban areas of the state. How do you go about addressing capacities and handling those situations in rural areas like ours, perhaps differently than urban areas like Milwaukee or the Fox Valley or Madison?
Yeah, it's a great question. We, as part of our statewide response, have stood up six strike teams, and one of those, as part of those, it is the assets of the state government across our system of state government, as well as representatives from rural, suburban, and urban hospital infrastructure facilities, so that we are getting the kind of input we need from the hospital community as we plan along these 6 areas, and one of those is surge capacity. And so when you're asking about the rural component of this, it is right on, and it is a top priority for us. That what is needed in rural communities is not exactly the same as, and they don't have the same assets as what we do in urban and suburban communities. And so how we think about that, how we plan for that, how we work together to make sure those communities' needs can be met is a critical part of what is happening in our statewide response with the partnership of the healthcare and hospital system, who have graciously agreed to help populate these strike teams who are doing the planning and the logistical work so that we've got the capacity we need when we need it.
Thank you.
Ben, to Charlie Presser from the Crawford County Independent. Charlie?
Hello. My question is about the ability to conduct the tests. I was been informed that statewide, and I think Dr. Westergaard spoke to it, there's not that testing capability that there might be. And he's talking about going into next week. How much testing in terms of numbers are available to the state right now?
So there are a number of labs up and running in the state of Wisconsin right now. The State Lab of Hygiene is running about 400 tests a day. The Milwaukee Health Department is running. Children's Hospital of Wisconsin in Milwaukee is running. A number of Freighter is running. So there are Mayo Clinic here on the Wisconsin side is partnering with their lab on the Minnesota side, so that that's where, as I understand it, their tests are running. So it is this partnership across the state among our clinical labs and the state lab and some private labs who are going to be coming online here soon to build our capacity, to expand it, and to do everything we can to make sure that among our various healthcare systems there are places for these tests to go to be run, to then be connected back in to the reporting system that we need to make sure we're tracking the disease.
Charlie, do you have a follow-up?
Yeah, in a county I'm familiar with, there's about 0.2% of the population now tested. Not 2%, but 0.2%. What is a percentage of population that you would like to see tested?
So I'm going to let Dr. Westergaard talk about surveillance and how that works on a population level, because I think that's super helpful. But I do want to say that we aren't recommending that people with mild symptoms need to be tested. That because most folks are going to who get this disease are going to have mild symptoms, we need them to stay at home and do what they would if they were otherwise sick, take care of themselves. If you have an underlying health condition or you have more severe symptoms, you need to be in touch with your doctor, and you need to make sure you're taking care of that. But I do want to be clear that it is not our recommendation that testing be done for everyone who wants it because it isn't necessary to do that from a surveillance perspective to understand the disease. And I'll let the doctor describe that.
Yeah, I think that's exactly right. You do want a sizable percentage of the people who have an influenza-like illness, meaning fever and lower respiratory illness, so cough, shortness of breath, to sort of test that the sort of illness that someone would go to the doctor for and get a flu test, for example. So that number, our guidance is that most people who have an influenza-like illness with fever and respiratory symptoms should get tested. And if they require hospitalization, that is our priority level. So we recommend testing in all of those cases. People with mild symptoms, we don't need to know a very high percentage of people with COVID-19 because we have ways to sort of say, of the proportion of people with severe illness, how many have COVID-19, how many have influenza, and we can do surveillance to say, well, in this community, COVID-19 is spreading in terms of this proportion of illnesses and compared to other alternates. So we do this with influenza and other respiratory viruses every year, and we can track epidemics coming and peaking and going with really testing and diagnosing a relatively small number of cases. So in the hospital, I think the big decision is where infection control interventions are so critical, we want to know everyone who has COVID-19 disease and do testing. On a population level, we don't need to test the majority of people, really just the tip of the iceberg of people with symptoms to know where it's coming and where we are in the epidemic.
Thank you, Charlie. Moving on to Mike Biermeister from WXOW in La Crosse. Mike?
Hi, yes. My question is, obviously we're up here in La Crosse, we're living in a college town, so we have a lot of dormitories as well as hotels. Is it being explored at all to utilize those if these cases are to continue growing and growing throughout our state?
So, as I mentioned, part of our planning from a statewide perspective is around the logistics for those kinds of potentialities. So if you need additional isolation space, say you've got a family, one person is symptomatic and their test is pending, where can they go so that they're not potentially infecting the rest of the members of the family? And so all of that planning around potential additional isolation capacity as well as the surge capacity that we may need in the hospital and healthcare space is absolutely underway, and all of those options are on the table, whether it's dorms or hotels or other facilities that are within state government's control as our property, et cetera. So our friends at the National Guard and WEM are working very closely with us on the planning and logistics and identifying of those kinds of options so that we can execute on a plan about where they need to be, how many we need, et cetera, moving forward.
Follow up, Mike?
And in terms of daycare centers, I know there was an emergency mandate made to limit them. Some have closed already. Others are trying to work with these new restrictions. How does that message change today in terms of the governor's announcement going forward? What would you say to those child care providers?
Well, we're going to continue to work with them so that, here's the bottom line. For the state of Wisconsin, we need to make sure that our healthcare workers are taken care of, and that means that their children are taken care of if they need that kind of assistance. And so that was the basis of the executive order, and it is a focus. We have to. This is a healthcare issue. This is a healthcare problem that we have to solve, and it's going to be solved not just for the three of us sitting here, but it's going to be solved by, frankly, the people that are doing the work. So we are, to make a long story short, we're trying to make those access to child care for the healthcare workers possible. We're obviously also working with others to make sure that there are possible alternate facilities found, and I know that for other kids that need to have their needs taken care of, and we're having some success of that across the state our Department of Children and Families, and others that are connected with that organization, that department, are actively seeking and working to have the child care industry stay in business, but most importantly, serve our healthcare workers.
Thank you, Mike.
All right, thank you.
Addie Bink from WFRB in Green Bay. Addie?
Hi, can you hear me?
Yes, we can.
Great. I was just wondering if you could tell us how many patients have recovered from the coronavirus.
So I think I'm going to let Dr. Westergaard talk about it because that's a more of a scientific question.
Sure,
Yeah.
Sure. We expect that most, very high percentage of people will recover. About 80 to 90% of people who get the novel coronavirus disease have mild symptoms that don't require hospitalization, and it resolves. People fully improve without any treatment. So it's really the 10% who require hospitalization in places around the world where we're starting to see about 1% have died overall. So the majority of people do well and recover. So we don't have ways, now that we have 200 cases, of determining each and every person when they have recovered. We have guidance for health departments and providers and also families on when you can consider someone's illness to have run its course for the purpose of releasing them from isolation. And the standard we use there is that symptoms have to be completely resolved for 3 days, no fever, symptoms have improved, and at least 7 days have gone by. So we think that's using that standard. We say that most people, if those two conditions are met, well for 3 days and 7 days total, they're no longer infectious to others. So that's our guidance for people to return to work and to be released from isolation. So the answer to the question is hopefully 99% of people who develop this disease will fall in that category and will recover after a week. We're really focusing on preserving our healthcare resources. For the few that are very critically ill, we can use all the resources we can to keep the number of people who die as low as possible.
Addie, do you have a follow-up?
No, that was perfect. Thank you.
Thank you. To Brian from WLUK in Green Bay. Brian?
We'll pass. Thank you.
Great, thank you. Rob Sussman from WTAQ Radio in Green Bay. Rob?
Hi, thanks for taking my question. This is for the governor. Governor, this morning, the mayors of Green Bay, Appleton, and Neenah called on the state to delay the April 7th election. Specifically, Green Bay Mayor Eric Genrich had said that conducting this election in the typical way will be a logistical train wreck and a public health travesty, given the current restrictions on gathering. How can the April 7th election be held in person, given the current state of the pandemic? And as you said, it is only expected to get worse over the next 2 weeks.
And I've talked to most of those mayors that you mentioned. First of all, my ability to move that date is non-existent. I don't have that authority. But I have to put it in perspective here. This is not just a primary election. Most importantly, it is a general election at which state officials, state Supreme Court, whether it's municipal officials at the county and local level, school board members are elected. All those positions are important in order for us to solve this problem. We can't afford to have any of those positions vacant for any period of time. If we move the date, that's exactly what would happen. Second issue is, it's in state statute when this takes place, and I have not been convinced, and these are my personal, since I don't have a ability to change it, I'm telling you my personal opinion, and that is moving this date is not going to solve the problem. We could move it to June. It could be worse in June. It could be worse in May. So the idea that let's just move it, to me, doesn't have any. And I understand it's a difficult situation. We had 3 states that did it just a few last week. But the bottom line is, it is going to be on April 7th, and we're asking our the most important ask here is for people to vote absentee. And all they have to do is go to myvote.wisconsin.gov by April 7th. They'll send you an online, or they'll send you a ballot, and you mail it in. You won't have to go in and vote. For those who do decide to vote, our municipalities will be doing everything in their power to make sure that there's social distancing at the poll, in line, and they'll be able to do it. Am I going to say that it's going to be issue-free? Absolutely not. But we have a democracy to participate in. And local and state races are really important. This is not around the primary. This is the primary. That's a national thing. But for me, it's about making sure that our democracy is able to persist. We're going to have a vote that's scheduled for April 7th, and there's frankly no good way to do it in a better way. So I'm counting on the officials. I talked to the mayor of Green Bay just today or yesterday. I can't remember which. I've talked to people in the Fox Valley. They may not like it, but they're committed to make it happen well. We can have it well, make it the best possible way by having people vote by mail. Pretty simple.
A quick follow-up. Could you see the entire election at some point becoming a mail-in only election? Is that something that could possibly be in the cards given state law?
Well, that could be. I mean, as you likely know, there's a lawsuit going on around that very issue to encourage, give some more flexibility around this mail-in. And yes, I think this is my opinion, is that having that opportunity to mail in is one that we should be considering going forward.
Thank you,
Thank you, Governor.
Jump in. This is Ryan Nelson, Governor Evers' Chief Legal Counsel. The governor has directed the State Emergency Operations Center and General MAP to provide assistance to the Elections Commission, to clerks around the state. We have a task group set up just to address these issues, to make sure that, one, that there's adequate poll workers. That includes finding state employees, volunteers, and the Guard in order to staff the polls, and two, to make sure that, just as the governor stated, that this election can happen safely, and that includes looking at what all options are available in order to make sure that people can vote absentee and that those votes are counted.
Thank you very much. I appreciate it.
Thank you. So Sarah Thompson from WBAY in Green Bay. Sarah?
Hi, thanks for taking my call. Could you update us on the number of tests that you're able to process in a day? I think earlier in the week, perhaps Dr. Westergaard is the one that said around 400. Has that changed at all this week, or are you able to test more people?
So the state lab is running at about 400 tests a day, but I do think it's important to remember that there are a number of clinical labs around the state who are also running tests, and we continue to work with them and other partners in the private sector to expand capacity. So the capacity of the state lab is about 400 a day, but there are other folks up and running and conducting tests, and that's some of what you're seeing in our daily, as you've seen that daily negative test result number go up, that is because the state lab, as well as our other partners, are reporting into that system.
And then, as a follow-up, could you just clarify the rules or the changes today for the hair salons and nail salons of what people can do if it's just use common sense, or if they absolutely cannot go into, for instance, get a haircut?
This is Ryan. Yeah, this is Ryan Nelson, the governor's chief legal counsel. So there'll be an announcement issued very shortly clarifying this. Specifically, what that order will be clarifying is that those types of personal care businesses, such as hair salons, nail salons, and tattoo parlors, will not be able to be open, period.
And when would that go into effect?
That would go, one second, we'll provide that information shortly.
Okay, thank you.
That's to you, Sarah. Thank you. Now to Katie Anderson, also from WBAY. Katie? Okay, we'll move on to John Nizer from NBC 26 in Green Bay. John?
Hi, thanks for taking the call. Question regarding testing and the numbers and what you guys are looking for there. If you don't recommend everybody get tested, how do you get a good grasp on the state's overall numbers? And is that final number an important piece of this whole puzzle?
Brian?
I can take that one. So enough data have accumulated nationally and internationally that we have a pretty good handle on the proportion of cases that are severe and require hospitalization. The large series of patients that were described out of China said that only about 14% of the cases were diagnosed. So that means 86% of the cases that are out there were undiagnosed. So our priority is to identify people who have symptoms that require hospitalization and particularly require ICU care. And we know that that's just the tip of the iceberg because we know in general how big the lower part of the iceberg is from accumulating research we can get, but we can have a good sense about the overall size of the epidemic. Now, I'd say there's also good public health reasons to not want to test people with mild symptoms because those tests have to happen in a healthcare setting. And the other thing that we've learned, which is concerning about this virus, is that people who have very mild symptoms or may be infected and have no symptoms at all have high levels of virus in their nose and their throat and are therefore as contagious as people who are severely ill. So it's actually in everyone's interest for the majority of people who have mild symptoms to have access to things like telehealth and a nurse triage line so they can say, I'm not feeling well, but I checked my heart rate, and my heart rate is okay. People have lung disease, they can check their oxygen saturation and say, okay, I'm one of the 90% of people who have mild disease that don't require hospitalization. Even if a large number of those people have COVID-19, the best thing to do from a public health perspective is for them to get support and stay isolated at home, provided that we have a good system for getting people's medical needs met if they get worse. And that's one of the things we're really working on is to make sure that health systems and local public health have ways to make sure that people can feel connected and feel comfortable being recovering at home when they have mild illness.
And the follow-up, John.
Yeah, do you guys have any predictions at this point as to what percentage of people in Wisconsin might get coronavirus at some time?
Yeah, we certainly don't have a good way to predict, and it's determined by so many things that I would emphasize that we have control over, that it's almost not helpful to predict. I think the number of people who get infected this year is going to be directly proportional to how well we do the two main pieces of infection control, which is on the individual level, everyone staying separated physically and having good hand hygiene and respiratory etiquette, and then also complying with these whole community level things about eliminating social gatherings. So if we implement those things very well, the total number of people infected could be relatively low. Modeling that's done sort of internationally says that if we don't do any of those things, the majority of the population, 70%, could become infected with the virus. So under normal circumstances, this virus is contagious enough that most people could get it. But what our message is that we have control over that percentage, and doing the things that we're recommending well by all people is going to keep it as low as possible.
Great, thank you.
Maddie Heim from USA Today Network. Maddie? Maddie Heim? Okay, moving on to Jessica Ben Egren from up north. Jessica?
Hi, thanks for taking my call. I've seen in a couple of different places that like sewing shops and other people are wanting to make masks for nurses and other healthcare professionals. Is this advisable? And if so, is there going to be some sort of standard, pattern that is sent out to make sure that staff does remain safe? That's my question.
So we have heard from at least one Wisconsin manufacturer who has expressed an interest in doing exactly what you're talking about. We are in active conversations with them about whether and how that could be done. But again, all options are on the table as we look like states across this country to address some of the critical shortages that we need to in the area of protective equipment.
Okay. But as far as like individual people that are at their homes and want to make masks, I guess, is that advisable?
So it's, we're sadly in a public health crisis, so there's room for innovation. I would say we'd like to do things with data to know that reusable or cloth masks are actually as effective. Frankly, don't know that. There's some concern that wearing reusable masks, if people wear them for a long time and breathe on them, people might touch their face and contaminate their hands, and it might undermine some of our hand hygiene messages. So we don't know. It's all about the implementation of it, and we really need good science. But I think we're in a situation where we need to explore all those possibilities. But as of right now, I don't think we're moving in that direction. But we're encouraging all ideas are on the table.
Thank you,
Jessica. Thanks.
Andy Moore from PBS Wisconsin. Andy?
Yes, Secretary-Designee Palm, did I hear you say 207 positives as of this afternoon?
206.
206. Did
Yes.
you say how many of the 206 are hospitalized?
No.
Okay, and is that unknown?
I do not have that information with me. They give me the latest numbers as I'm walking in here to do this briefing with you all, because we're doing it in real time and posting it to the website. So I don't know the answer to that question.
I would say in the Division of Public Health, we don't have those numbers on a real-time basis. We are looking at ways to try to capture that using electronic means. It's a very dynamic situation. Some people are diagnosed in an outpatient setting, symptoms worsen, and then they become hospitalized. Some people are hospitalized for a short period of time and then go home. So it's a very dynamic situation to target. We're looking at sort of additional strategies to try to have a good handle on that around the idea of planning for surge capacity. So that's something that we hope to be able to monitor and report on in the future when we identify the best sources of information that we can track that.
Okay, thank you.
So Will Keneally from PBS Wisconsin. Will?
Hi, thank you. You'd mentioned the 620 ventilators before. Is there an optimal number that you'd like to get to during this escalating outbreak?
So I think that's part of our of the planning efforts that's underway. I think as Ryan has articulated here, as it relates to some of the recent questions on this call, our goal is to execute well on the strategies that we know work to reduce the spread of the illness and therefore reduce severe disease. And so we need to plan for scenarios in which we don't do those things well. But the things we should be focused on right now is doing what we know works really well so that we protect the healthcare system so that it is not overwhelmed with severe disease as this progresses.
A follow-up, Will.
Thank you. And I was also curious, had there been any discussions about building kind of alternative hospital facilities?
So as I mentioned, there is an effort as part of our statewide response pulling in the other parts of the state government to work on this with us around surge capacity as it relates both to isolation as well as potentially needed hospital beds. And all of those options are on the table. We have some experts as part of our emergency management function and others who are surveilling what sort of facilities and options there are as the planning team is looking at thinking through the scenarios of what we might need. And so that's very actively underway right now.
Thank you, Will. To Sean Kirby from Wisconsin Health News. Sean?
Hi.
I was wondering, could you guys talk a little bit about or quantify how many supplies are coming from the national stockpile that were received yesterday?
I do have those numbers, Sean. So this shipment that we are getting from the Federal Strategic National Stockpile includes 54,709 N95 respirators. It includes 130,326 surgical masks. It includes 24,816 face shields. It includes 20,233 surgical gowns, 104 coveralls, and 72,044 pairs of gloves.
In terms of Medicaid, you had mentioned telehealth being something you guys are pursuing. Are you guys looking at other changes, including, I know a few states have done emergency waivers?
Yeah, so connected, but a little bit different. So we did working with the legislature in the fall. The governor was able to sign a telehealth bill that gives us quite a bit of authority in this space to expand access to telehealth through the Medicaid and Badger Care program. We have moved to start to implement pieces of that, including the ability to receive telehealth services in your home. In the very near future, in the next couple of days, we will be doing some more work specifically related to access to behavioral health through telehealth services, and continue to look at all of our flexibilities, either that were granted through the President's National Declaration of Emergency and through the legislation. Those include the opportunity not only to think about it flexibly, but to actually provide some reimbursement for additional services, which we obviously want to incent people to use as they stay at home for all unnecessary to avoid all unnecessary appointments and travel. So we are very actively looking at this. The private sector is doing a number of things similarly in this space, and our office, the Commissioner on Insurance, has been in active conversations with the private sector insurers that they oversee and regulate to make sure that we are encouraging them to do everything they can in their space and the plans that they offer in the private sector to allow the use of telehealth as much as possible.
Thank you.
This is Scott Bauer from the Associated Press. Scott?
Hi, thanks for doing this call yet again. Secretary Palm, could you go back again on the number of respirators you said you're getting or you received from the federal government?
Sure. 54,709 N95 respirators.
Is that it? That's in addition to the 620 you said we have now, or did I misunderstand that earlier number?
The 620 is ventilators.
I'm sorry, ventilators. Okay. Do you have estimates as to when the current supply will run out for ventilators, for ICU beds, for these critical needs that we have right now? What kind of mapping or projections do you have to say when you're expected to not have enough?
So this is a really critical part of the work that's happening right now to plan and to make sure that we, in our scenario planning, are building capacity to meet the need of those who have the most severe illness. I think respirators can be in short supply. We're seeing that in Italy. We are seeing it in the state of Washington. And so, as Dr. Westergaard has said, the things that are really critical now are to do the kinds of activities that reduce the spread of this disease and therefore reduce the number of people who are going to have severe disease so they don't need an ICU bed and a ventilator. That is our collective responsibility to do that now so that we don't put our healthcare system in a situation where we run out of ICU beds and or ventilators. That's a critical thing that we as Wisconsinites need to do together. And right, that's stay home as much as possible. That's the hygiene stuff. That's eliminate unnecessary travel. That's all of those things that we have been talking about and the sacrifices that everyone has already been making. We need to be super vigilant about that and really double down on that stuff right now so that all the plans we're making for surge capacity and to help our healthcare system as they are seeing more people with severe illness, that we maintain capacity beyond demand, and that's all about the things we do right now to prevent that.
So there's no way to estimate when that might happen?
Yeah, I mean, right, we're seeing an increase in cases every day, and so I think the epi curve is...
Our hope is that it never happens. Yeah. This is something that we have control over, and this is an important part of our discussion with the public as well, because if it gets to that point, then we have to make really hard decisions about withdrawing care or not offering ventilators to someone if no one wants to make those decisions. Doctors don't want to make those decisions. Certainly families need to be prepared for those possibilities. And we're working in collaboration with other states and with ethicists about the best framework to make those decisions. But our intention is for everyone to band together to do everything we possibly can to not get there. And because that's really what's at stake. That's when all of our individual level messages about social distancing and hand hygiene and all of our community level interventions about avoiding gathering are directly related to that. We can save people's lives who have severe disease from COVID-19, but we need all that technology. So our hope is that we use no more than we have, and we'll do the activities that we're doing to try to expand the work that we can. But the stakes are really high, and I think that's the message that we want the public to hear. All the things that we're talking about to limit the size of the epidemic are to save people's lives and prevent people from dying because we don't have enough resources.
Thank you, Scott. Megan Carpenter from Spectrum News 1. Megan from Spectrum News. Okay, and Stephanie Hawk from West Politics. Stephanie?
Hi.
Hi.
Hello. My question is directed to Dr. Ryan Westergaard. So why or why not can we compare COVID-19 to other respiratory illnesses like influenza?
That's a good question. So I think the most important way in which they're similar is how they're transmitted. So I think the respiratory virus that most people are familiar with is influenza, which causes the flu, which is fever, shortness of breath, and that causes a lot of severe illness, every single year. So the overall mortality rate for influenza disease is about 1 per 1,000. What we're learning about the virus that causes COVID-19 is that the mortality rate is about 1 per 100. So while they're spread in very much the same way, the mortality rate for the virus that causes COVID-19 is about at least 10 times higher. So that's one important difference. The other difference when it gets to how viruses are transmitted is that the COVID-19 virus is very easily transmitted. People can shed the virus for a longer period of time, and people can be contagious before they're symptomatic. So that's another distinctive feature which makes this a really serious situation, is that people can have mild symptoms of the disease or no symptoms at all and still be able to transmit the virus to other people. The third, and all of these comparisons are unfortunate. I wish they weren't the case, but this is why it's a serious situation. The third difference is that we don't have a vaccine and we don't have treatment. So those are kind of three reasons why the stakes are really higher for this pandemic than really all of our other respiratory viruses, is that we don't have as many tools to prevent it, and the risk of it spreading around the world, as we're seeing, is really high because of the features about the virus.
Want to follow up, Stephanie?
Is COVID-19 classified as like a chronic lower respiratory illness?
Yeah, COVID-19 is the name that we gave to the whole spectrum of symptoms that people get when they get infected with this particular virus. The virus has a different name. It's called SARS coronavirus type 2 because it's very closely related to a virus that caused the SARS epidemic nearly 20 years ago. So the name of the virus is SARS-CoV-2. COVID-19 is the name of the disease that it causes. And we would classify it, I would say, as an acute respiratory illness that can cause upper respiratory disease, like the common cold, but also lower respiratory disease, which is pneumonia, severe lung injury. So it can do
Isaiah Holmes from Wisconsin Examiner. Isaiah?
Hello. So I was curious, are there any efforts right now to increase healthcare workers or anything to kind of alleviate burnout among healthcare workers right now? And can we also get an update on the situation in Milwaukee County and the city of Milwaukee?
I can address the one part of the worker shortage. First of all, in a couple of ways. One is to make sure that they have child care available to them, and we're working hard to make that happen. Second of all, our Department of Safety and Professional Services that license several of the healthcare workers are finding ways to, exploring ways to short circuit. We're not dumbing down the professions, but we're finding ways to short circuit and the time it takes to become licensed. The internal organizations there, and we're doing a good job of that. So we're dealing with it from people wanting to get into the profession, but we're also dealing with it as it relates to making sure that healthcare workers have child care opportunities. There's another angle of that I missed. So. Go ahead.
Thank you.
Okay.
Right. Matt Piper from the Sheboygan Press. Matt?
Yes, thank you. I just wanted to be clear on something earlier. I know your request to the federal emergency stockpile was the same as the numbers that you quoted about what you're getting. So they responded to your request by saying, yeah, sure, we can do that. And were those numbers based on just sort of your state's share of that?
We've requested we've requested as much as we can get our hands on. I think is probably the thing to say about that. The federal strategic national stockpile contains what it contains, and when you have situations like this, they make a calculation based on population to distribute to every state in the union, and so this first shipment that we got is the start of a preliminary calculation from them based on what our share of what is in the federal strategic national stockpile would be. So we do expect additional releases from them as this moves forward. We will continue to ask for more, but there is what there is in the federal stockpile. We will get our share of that. We will press particularly when and if we need to escalate that harder for more than our fair share, and continue to work with private sector partners and others to find other ways to try to meet these needs.
Yeah. Thank you for that clarification. That was helpful. Also, I believe you mentioned that there were ventilators in the stockpile, and that you were hopeful that you would get your state share of that as well. What is Wisconsin's share of the available ventilator? Is that known, even if it's just roughly?
I don't know that off the top of my head, but we can get back to you.
We will follow up on that for you, Matt. And our final question this afternoon comes from Austin Montgomery from the Beloit Daily News. Austin? Austin from the Beloit Daily News.
Hi, can you hear me? This is Megan Carpenter. If Austin is not there, I am on the call.
Well, go ahead then, Megan.
Okay, sorry about that. I'm not sure what happened. I hit *6 and nothing happened. So, but I'm here now. I do have a question as it relates to the 3 deaths that have been confirmed. I know you're obviously not commenting on individual cases right now, but could you just give us a sense of how these 3 people contracted the virus, and if it was through community spread, can you tell us if that is now the majority of the cases that you are seeing in the state?
I would say that in the state, as in nationally, the majority of cases, when we hear about the case, initial investigation, whereas our first dozen cases, it was clear there was a travel-related risk factor or a contact-related risk factor. I would say for our first 10 or so cases, that was obvious in most cases. I would say the majority of the cases that we're seeing now, those connections are not obvious. Can't say definitively, of course, because there's a process of investigating and doing contact tracing and finding out whether there may have been a known case. So we don't have that. We can't summarize that information with precision. But the national data of the 14,000 people who have been diagnosed in the U.S., only a small fraction have been a confirmed contact of a case. So I would say it's fair to say that most new infections that we're hearing about are a result of community spread.
Okay, thank you. And a follow-up question. I didn't get all the numbers that you were reading from the federal shipment. Can you please just reiterate how many masks we're getting?
The N95 respirators or the surgical masks?
The surgical masks, please.
Surgical masks are 130,326.
Okay, thank you very much.
Sure thing.
Thank you, Megan. And with that, we thank you for joining today's media briefing. If you have any additional questions, you can email those to dhsmedia@dhs.wisconsin.gov or call us the media line at 608-266-1683. Also, a reminder to continue to monitor the DHS Outbreaks and Investigations page and the COVID-19 page at dhs.wisconsin.gov for updates on this investigation and pandemic preparation and for the test results as well. Thank you, and have a good weekend.
Goodbye.
This program is a production of WisconsinEye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. WisconsinEye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.